The joy of being parents and bringing baby home can't have any substitute. However, there are things that first-time parents should focus on. Preparing things before birth to ensure newborn care when leaving the hospital and bringing the new baby at home. Congrats! If you are watching this video, you must have recently got pregnant or going to give birth in the upcoming days. So here we will describe in detail the perks of preparing for the newborn baby's arrival, bringing the newborn baby home, baby cry, pee, and other schedules. Let's begin. What's the best way to bring baby home? Medications are provided to pregnant patients with children who are not pregnant and have naivety. This includes checking for soundness and a pregnancy assessment before the child's birth. Depending on your child's age, other tests are also possible. Your family doctor can monitor your health. New mothers must understand the symptoms of pregnancy complications and have an early start to feel confident in breastfeeding. Please stay away from the hospital in a hurry. Things to do before leaving the hospital. Before leaving the hospital, make sure to dress your baby as you would dress yourself. Being a parent, most are too cautious about packing their baby all over from head to feet in warm weather. You must avoid that. It's what hospital staff suggests too. Keeping in mind these tips, it's highly probable that you bring a calm and contented new baby home instead of crying and screaming in a complicated outfit that the new parent has struggled to put on. The parents of premature babies born before the due date and full-term babies must not feel rushed out the door in all the excitement of bringing the baby at home. First, schedule your baby's first checkup, then clear out every doubt and confusion regarding breastfeeding, bathing, burping, etc. Ask your baby's doctor or the friendly hospital staff, specifically nurses. Depending on different circumstances, some new parents of premature babies are also allowed for baby home bringing with a special monitor for inspecting heart and breathing rate. You may also need to get pretty basic knowledge and training in CPR, cardiopulmonary resuscitation. Car seats for babies. Baby car seats are best for ensuring a safe trip from hospital to home. Almost every state binds new parents to have one installed with the car's rear seat before leaving the hospital. Even if your home is nearby, holding the baby in your hands is never safe, as a quick stop can pull from your arms, throwing the baby against the dashboard. That's why you must make sure to buy, rent, or borrow a car seat before birth. The baby car seat can be of two types. They can be either convertible seats or infant-only seats. Let's briefly introduce both to make a perfect selection and avoid complications while bringing a newborn baby home. Convertible seat. These are rear-facing car seats for infants. The convertible car seat is used for infants to 2-year-old babies. Keep in mind putting a rear-facing seat in the front car seat can be dangerous for the infant. Strictly avoid this. Infant-only seat. These seats are specifically designed for rear-facing use and fit the infant better than the convertible seats. Same as convertible seats, these seats can also be used until the baby reaches the age of 2 years. Here is everything you should know about the baby's routine and different health concerns. Newborn baby's pee and poop schedule. Breastfeeding babies are given 5 wet diapers every day. Often infants are fed with formula and can have as much as 10 times daily. It also includes the wide range of bowel movements considered normal. A breastfed baby usually poops more than bottle-feeding babies since the formula takes a bit longer to digest. Breastfed infants go as rarely as every 4 hours to twice daily. Formula-fed infants usually poop once or twice daily, but the average amount can be between 1 poop every 2 days or several poops a day. First-time feeding. If you and your baby both are feeling well, you can start breastfeeding your baby within 1 hour after birth in the same room where you gave birth, in delivery, or in the emergency room. Right after birth, most infants are dried off and placed on the mother's chest. This skin-to-skin interaction helps a lot in encouraging breastfeeding. You can stroke your baby's cheek closest to the nipple. In reaction, the baby will turn his or her head toward the stroke and open his mouth wide. However, if you had a C-section, you can do this skin-to-skin interaction when you are able to. Newborn feeding. Because newborn baby foods can be small, the stomach can easily absorb large portions. Occasionally, some people need to be nursed every couple of minutes or drink every hour, others have hunger. While some babies are screaming and declaring their hunger, others have more subtle hunger signals, snaking or grabbing their hands or turning their heads towards their stomachs. Newborn crying. Your child is crying. How often, how tough, and for exactly the same time will vary. Most newborn babies sleep very quietly during their first couple of days. A typical infant stays awake and cries for 2 hours every night at 2 weeks of age. However, at the first night situation may vary. Strong cries peaks typically between 4 to 6 weeks and gradually fades. If the infant is crying 3 times in a row or more per week, the crying should last an entire 3-week period. Eventually, you will understand how your baby is screaming. In short, crying pattern varies with baby's growth. Newborn sleep patterns. Your little body can avoid sleeping for at least several hours before they wake up to eat. The shorter nap will add up, but the newborn sleeps between 16 and 18 hours daily. You should be able to track the times your baby sleeps and determine the patterns. Fortunately, newbies in the world can fall asleep almost anywhere. No matter where a child sleeps, put it on its back and eliminate all loose blankets, pillowcases, pillows, quilts, and toys to prevent premature death. Newborn burps, hiccups, and spit up. Some newborn babies require frequent burping, while others burp alone. If your infant is upset or nauseous when feeding, it indicates that the baby needs to burp. You can burp your child after putting the tummy on a tummy or after feeding for 10 to 15 minutes. Hopefully, you have a pattern in place after a few days of feeding. You don't have to rub the back, just move it gently to pat it on. Newborn breathing. A new routine is regular breathing. They may slow down a moment or even 2 before breathing again. While normal, it is sometimes scary. These symptoms are generally not symptomatic and require immediate treatment. Newborn bath time. It's pretty simple to take care of your newborn for a few days. There will not be a baby bath at present. The baby's limb is still attached when your child is still in his uterus. Take a child bath to make a good recovery. Usually, people do not recommend immersing the stumps in the water. Sponge baths keep the baby sanitized for 1 to 2 days. Too much water can irritate a baby's skin. Use a warm, damp washing cloth to gently wipe down neck folds and other spots where breast milk, formula, or water accumulates and ends in the genitals. What should I prepare for new baby at home? Some new mothers have taken prenatal courses at birth. The courses prepare you to have a birth and offer advice on infant care. Generally, these prenatal classes are designed to help you understand the basics of nutrition, common illnesses, the daily routine, and your child's safety. Get information on parenting resources in your area. Many local health centers support breastfeeding as it is a safe treatment method for a baby. Community centers sometimes offer a program for meeting new parents. The baby should have constant medical attention before birth. Here's what you should prepare for newborn baby at home. Baby's room. Most mommies have already set up nurseries for their newborn babies coming home. A typical baby nursery contains a crib. Make sure when you come home with your new baby, the crib is already set up and it's ready to welcome your baby. Other things that your baby's nursery must have include: cot, 3 or more waterproof mattress pads and linen sheets for the cot. Rocking chair. Feeder bottle, 6 to 4 ounces, with nipples. 5 bibs and burp cloth. Formula, if recommended by the pediatrician. Changing table. Essential accessories for changing tables include nappy rash oil, nappies, nappy bin, baby oil, baby wipes, and many baby washcloths. If you are using cloth nappies for your newborn, you must stock 1 to 2 dozen of them. However, in the case of disposable nappies, you will need 10 to 15 nappies per day. Baby purses are another important accessory you must not miss out on. Newborn clothes. Cute clothes may take the lower seat initially to comfort and ease. Many children wear 1 or 2 pieces of bodysuits and pajamas with socks or blankets in cold weather or the evening. If the baby has sensitive uterus and limb muscles, one-piece clothing can be helpful when you need it most. Most hospital newborn babies are sent back with a hat. However, a hat may be omitted in hot weather. Best clothing for newborn. When buying clothes for your newborn, you must remember that the clothes they buy must be comfy and easy to take care of. What most mothers prefer is to get lots of stretchy jumpsuits that fasten from the front. These jumpsuits are considered the comfiest dresses for new babies. If you are looking for easy-to-wear dresses, go with buying the jumpsuits with zip. Tops with envelope heads will also work best as they can quickly get over the baby's head. Confused about stuff? For summer clothes, prefer cotton as it keeps your baby cooler in hot summers. However, you must prefer merino wool fabric clothing for winter. They are best for regulating body temperature when being cozy and gentle. The most important thing to look for is the low fire hazard label. This label represents that the clothing is a lower fire risk. All of your new baby's jumpsuits and rompers must have this label. What do new parents feel about bringing baby home? Usually, both mother and father have mixed feelings when bringing the newborns home, nervous and excited at the same time. Newborns' mothers may also experience baby blues or feel drained physically depending on whether their baby is born through natural birth or C-section. Moreover, your spouse may feel left out, finding you all engrossed with the baby. Don't worry, as things begin to normalize after the first few months of the baby being your family member. However, if you have other kids, tying the bond between them and their newest family member may be tricky. Most parents must make sure to limit the arrival of the number of guests to let the baby and the mother rest for the time being. Though babies aren't shy around strangers in the first few weeks to the first 3 months, too many people around can overstimulate and fatigue them. Conclusion. That was all about the perks of bringing the newborn baby home. I hope this video may have helped to clear any confusion about the arrangements you have to make before the child's birth, for bringing the newborns home safely and the routine of new babies. If you liked this video, make sure to give it a thumbs up and also subscribe to our channel for more informative videos like this one.